Secretary Austin has been hospitalized at Walter Reed National Military Medical Center since January 1st. He went in because of some complications he had following a surgery. We found out more than a week into his hospitalization that the surgery was for prostate cancer that was diagnosed in early December. He had a procedure on December 22nd to treat it, and then went into the hospital on New Year's Day complaining of abdominal and hip pain. Where he was diagnosed with a urinary tract infection that he has since been in the hospital being treated for. So Secretary Austin went into the hospital via ambulance on New Year's Day. The following day, his chief of staff was notified that he was in the hospital, but she herself was sick at home with the flu. And so the Pentagon has said that that is the reason that it took 2 days for her to notify the White House that the Secretary of Defense was hospitalized, and then the following day Congress was notified, and then a few hours later the Pentagon put out a public statement. Part of the reason that all of this has created so much uproar is that several days delay in notification time for even the president, let alone the rest of the American public, but also because Austin did not originally disclose his cancer diagnosis to the president back in early December when he first got it. So there's been several different layers of fallout. Within the Pentagon, there's now an Office of the Secretary of Defense review of not only this particular situation, but the procedures that should be carried out when the Secretary of Defense is incapacitated, how his deputies should be notified, how the President and Congress should be notified. The Pentagon's Inspector General also announced that they're going to do their own review of the situation. And then there's even more fallout on Capitol Hill. Congressional Republicans have called for his resignation, have called for an impeachment, and are continuing to voice their concerns. So initially the White House was very supportive. The president said that he had spoken to the defense secretary and was looking forward to him getting back to work. Later on, it came out that not only had the defense secretary not told the president that he was in the hospital, but he also hadn't told him that he had cancer at all. And so the national security spokesman, John Kirby, had said recently that it was not the ideal way to find out all of this health information about Secretary Austin, that they would have probably preferred to get a private notification. So Secretary Austin's prognosis is good. His cancer prognosis is good, also recovering from this infection. He's expected to make a full recovery. The Pentagon hasn't said anything specific about when he will be back in the building or whether this is going to affect any of the travel that he might have scheduled, but they're not making any sort of determinations at this point, whether he's going to be back soon or whether this is going to take a longer time, only that he's expected to fully recover. Deputy Defense Secretary Kathleen Hicks is doing some of Austin's duties in the building, but technically Austin has full control over the chain of command from his hospital room at Walter Reed.